Hello everyone, I'm Hanisha, your host for the day, here to bring you some amazing speakers, insightful discussions, and hopefully a few laughs here and there. Shall we get started with next session then? I'm here to bring you a very powerful keynote by Dr. Triveni MG, Director, Health and Family Welfare, Government of Karnataka. Let's welcome her with a great round of applause.
Namaste. Good morning, everyone. I would like to begin my session with the words of one of the greatest musicians of South India, that is Endaro Mahanubavalu Andariki Vandanamulu. There are so many great people here, and I salute each one of you by Tyagarajalu. So, good morning, ladies and gentlemen, and esteemed guests, and all healthcare enthusiasts gathered here at 14th NASSCOM Life Sciences Health Innovation Forum. I am Dr. Triveni. I am the Director of Health and Family Welfare Services. I am a gynecologist. And what one of the esteemed speakers said here, I totally agree with you, sir, that what better use can it be there for AI than saving lives. I totally agree with you. And in health and family welfare services, we cater to primary and secondary healthcare services. And at least I am hopeful. It's my dream that whatever you people spoke here, one day it may become a reality in our government services, and the poorest of the poor should get those services also. So, I'm honored to be addressing you all today at this crucial juncture of technological advances in healthcare technologies. The motto of this forum is a strong reminder about the journey that awaits us in healthcare in future. As we stand at the cusp of a new era in healthcare, AI is revolutionizing the way we approach patient care, disease diagnosis, and treatment. Karnataka, with its rich legacy of innovation and technological prowess, is poised to harness the potential of AI to create a more efficient, effective, and patient-centric healthcare system. On a lighter note, I'm scared about what I read, what Mr. Elon Musk says, that AI is going to replace humans and all that. But that, I think, is a long way. Right now, I think we can use AI to support and improvise our system. The application of AI in healthcare are vast and varied, from predictive analytics and personalized medicine to medical imaging and clinical decision support systems. AI is enabling healthcare professionals to make more informed decisions, improve patient outcomes, and streamline clinical workflows. However, as we embark on this journey, we must also acknowledge the challenges, the limitations of AI in healthcare. We need to ensure that AI systems are transparent, explainable, and fair, and that they prioritize patient safety and data privacy. To fully leverage the potential of AI in healthcare, we need to foster a culture of collaboration and innovation. This requires us to bring together clinicians, researchers, data scientists, and industry experts to co-create solutions that address real-world healthcare challenges. The government of Karnataka has taken some steps, maybe baby steps, as initiatives in terms of utilizing AI in public healthcare. The government has made zero cost, for example, the government has made zero cost MOU to conduct pilot study in AI-based TB and lung pathology detection in chest X-rays across 8 hospitals in Karnataka. The proposal to include AI in teleradiology systems is also being considered very strongly by the government. We are strongly considering the use of AI-based data entry systems in the ABDM compliant hospital management system solutions that is in the process of deployment. AI-based analytics shall be incorporated into the dashboards that would be rolled out in near future to monitor community-based population health parameters. For example, in case there is any outbreak of a disease, so that has to be in real time. It is being incorporated into dashboards. So this will give us predictive tools and also to control effectively the outbreaks. These are the problems we face in public health. However, being from a diverse healthcare system of public health, I would like to highlight the necessary basic steps before we dive into the AI-based health systems. How do we make sure or ensure health systems are digitized into the fullest, and how do we ensure that this happens in sync with the needs of the doctor and other health workers in the public health system? How do patients start respecting health data? Not only the urban technologically advanced ones, but also the ones in the extreme faraway places, in forest areas like Chamarajanagar district or Kodagu. How can this reduce inequity not only in financial terms but also in all possible aspects? Bridging the gap of digital illiteracy is also a looming problem for healthcare providers and including the patients. We should think about bringing in regulatory framework for such AI-based systems in healthcare, since accountability is of paramount importance. Also, we are dealing with live person in every step that we take. So that patient-centric approach is very important. With these points being answered in parallel, I would like to put forth some of the problems that a large system like us deals with in the state. How do we ensure that none of the mothers or children die or are missed out from the tracking system? So this tracking is I'm not sure if you people can relate to these problems, because these are basic ground level problems that we see, unlike what we see in very advanced hospital care. We need to track patients. We need to track the poorest of the poor. They may not even have a mobile with them. So these things, and we have to deliver, we have to direct them to a safe place of either delivery or health, any other health care. And they become inaccessible to us many times. So these are the problems, and we hope that AI will help us in these things. How can diagnostics be available at the remote parts of the state, including IoT, in a good amalgamation with AI? So many times we find HR not being, especially doctors, they are unwilling to go to remote villages, but still we need to provide them with healthcare. So I think AI-based IoTs will help us. How can we create inclusive collaboration systems of reporting to measure the true quantum of a public health problem, like I said, an outbreak can happen? And how can we ensure that all private, government, non-profit organizations, aid healthcare institutions help in building a citizen-centric profile of public health? How can we deliver cost-effective diagnostic services to people in villages? How can we reduce the divide in health information for people in the state? I understand that AI is very powerful, and I'm quite sure that with the right partnerships, we could come up with some technologies that are scalable to answer these questions. I would also take this opportunity to inform the private sector representatives here to remember that if the problem that is being addressed by the AI technology, robotics, is something that government is actually concerned about, and as long as the total cost is very important for us, cost of the ownership of the government is kept at a minimum, and the solution is scalable, government is ready to use the solutions. In this era, AI being in creating art as well, for IEC activities also we can use this. The state would be more than willing to partner to solve important questions to improve the health of the people in Karnataka. We need to keep it ethical, efficient, cost-effective, scalable, and at the same time effective as well. I hope that this forum would broaden the scope of AI in healthcare, encompassing all the crucial paradigms, and together we could create systems that would deliver the right service to the right people at the right time. I thank you all for giving me this opportunity. to bring these issues to the table.
Thank you, Dr. Triveni. It's amazing to hear on how much AI could do. We request you to stay on the stage. I request Sudhanshu to hand over a token of appreciation to our dear speaker. And meanwhile, I invite all the innovators and other people to come join us in this initiative where COE is also looking to bring innovation to Tier 2 cities and remote villages of India. Let's bring innovation to Bharat, not just India. Right? So with next, from policy to processing power,